volunteers undertaking a community outreach program in the Volta region. Good morning and good to have you here in the studios. Now, briefly tell us about your organization and what inspired this outreach. So maybe you should start.
Sure. Thank you. So my name's Jocelyn. I'm the founder of Heart of Care Providers, which is a US-based organization, and we've come here in Ghana for this week to do a medical outreach. We've visited the villages before and prior and just trying to get an understanding of maybe some needs that may be in the specific region. And so collaborating with a lot of the local villages, we've been able to have that opportunity to bring medical care to the people as well as education. And we target it in a way where we're hoping to really touch on what their specific needs are, as well as providing a holistic approach to it. So we have different programs that we did this week, one being the medical care, where we've seen patients, and so far we've seen over 300 in 3 different villages, which has been great. The turnout has been wonderful, as well as just identifying educational needs and giving some of those outreaches as well, and focusing on girl empowerment and community involvement with the environment. So teaching about sustainability and about how to protect the environment.
So how has the mission been so far?
It's been amazing, and also knowing that it's also the National Public Health Week. Health for peace, peace for health, which is pretty interesting. Yeah, we've been, as you said, we've been to 3 communities, and health is not one way. It has to be holistic. If it has to become, if you need to speak about health for peace, it has to be. So we've been engaging women, young girls, old, male, female. We're actually having 3 projects. One is called CARE, one is called She Blooms, and the other is called CAP. CARE is basically where health practitioners go to communities where they give medication, doctor consultations, and also the She Blooms is actually female and women empowerment, where we teach girls on menstrual hygiene, we create awareness of cervical cancer, and we also share free pads to people. And also for the CAP project is a climate action project where we teach kids that basically health is not one way. It's not just about taking pills. It's not just about eating well. It's also about keeping the environment. So we did an upcycling project where we taught them what to do with nylons, what to do with waste tires, to just make sure the environment is clean.
And what has been their response?
Beautiful. Yeah. Beautiful, amazing. You can see yesterday we were up all night trying to get the tires, trying to clean up the communities. And the kids I'm talking about kids from like age 9 up until like 18. We even have women joined us in this project. So basically the response has been great, either from the medical outreach that we've been doing, from the Wood Care Initiative. It's been amazing across all schools too, because we also visited some schools.
But why the Volta region?
Interesting question. You have to start from one place. Basically, we're starting from Volta region, and then beginning from that, we're also able to get data to know exactly what is ailing other communities. We start from the Volta region, and then we'll go to other communities. That's the intention.
So if one wants to join the team, what are the process?
Yeah, so
is it open to everyone to join?
It is. So if you look online, you can go on heartofcareproviders.org and you can go and see the volunteer area and just show your interest. You know, we're always wanting people to join because it's a collaboration. None of this can be done just, ourselves. The more that believe in this project. So, yes.
Your team, I'm told, is described as international and multidisciplinary. How did this diversity, shape this outreach?
So interestingly, we had people from the US, Africa, locals from Ghana, and because they're coming with different stories, different craftsmanship, different practices from the medical world, you can see how we're able to engage these kids. Like I mentioned, it also talks about the multi-layered nature of the project, where we have creatives, we have people who does fitness, wellness approach. We also taught women. Basically, health sometimes might not be pills. You might just need a woman. For instance, on one of our outreaches, we had a woman talk about back pain. The instructor who is also into wellness was there, and she taught her major exercises she could do for her back, for her leg. And immediately she tried it right on spot. She felt relieved. This is a practical example to bring in like diversity into the team.
Great.
Yes.
So what's your final message?
Well, our final message is really, there's a lot of power in prevention, in preventative education, but also, like we've talked about already, there's a holistic piece to it. So you don't just tackle health in one direction. It takes on mental wellness. It takes on the environment, it takes on what things we can do. And I think 80 to 90% of, health is starting at the primary care level. So we must address this. Hypertension is silent. It is across the board, and maybe, 50, 60% of people that don't even know it until it's too late. So what we do is go in there and find those, cases and help them, but also teach them. So give them examples of things they can do now to protect them from the future and to avoid the disease itself.
Do you have anything to share briefly?
Yeah, public health for us is not just from April 6th up until April 12th. It goes round.
Okay.
We're talking, we're educating, we're creating awareness. And definitely, like you mentioned, people can join us, but not just beyond join. You can lend your voice, you can lend your money, you can lend your support through multiple ways. We do this all around the year, and we need people to join us.
I will lend my voice.
Yeah, yes. do this, please. You are ready.
Thank you very much for your time. So you just heard from Madam Joycelyn Lee and David Olukitibi, volunteers undertaking a community outreach program in the Volta region. We take a quick break. We are back shortly. Please stay with us.